It's been 300 days of birthing bypass at Gladstone Hospital in Queensland, meaning women are being transferred to Rockhampton Hospital over an hour away to give birth. Last month, maternity services in Gladstone reopened to women with no known risks, which has been criticised by medical staff. Joining me now is Jemma Manwaring, an advocate for local mums in Gladstone. Good to talk to you, Jemma. So 300 days without maternity services in Gladstone, which has an estimated population of about 60,000, I think. So what happened to those services 300 days ago?
Essentially, as you said, they were put on bypass. So up until last month, when some services were reinstated, mums were assessed in Gladstone and then transferred where safe to go to Rockhampton to birth.
Now, you don't have to go into any specifics, but do you know of any instances where things have gone wrong because there wasn't these services in town?
Yeah, there were two very, very close calls where mums were very, very unwell and had adverse situations arise very quickly. And in those instances, midwives actually broke protocol and phoned an on-call doctor here in town directly. At the time when those instances happened, it was before Christmas. Um, the protocol was that they actually had to phone Rockhampton first and essentially get permission to phone the on-call doctor here in Gladstone. So there's also been times that throughout CQHHS there's been one obstetrician working, and that was out of Rockhampton over Christmas. There was a mass walkout of obstetricians just before Christmas because of the conditions there. Let's bear in mind that that's not a normal thing to happen. And so we haven't had any deaths, but we've had very, very close calls, but also times where staff and families have felt so uncertain about getting emergency care because it wasn't available.
Where are we up to? What's the current plans to bring full maternity services back to town, including obstetrics?
Sure. So we're told that the middle of the year, which is not that far away, and we should have full services back. That's all we've been told so far. So, like you said, at the moment, mothers who are 37 weeks and over with no known risks can birth in Gladstone. But that still means that about half the number of mums who should normally be able to birth here are not being able to do that, and they're still being transferred to Rockhampton. So this still affects a lot of women in our town and our region.
Queensland Labor MP Glenn Butcher in October last year said he would quit if full maternity services were not restored at Gladstone. What is the latest from him, or have you been hearing anything from Health Minister Yvette Darth?
I have reached out. We're having a community rally today, a catch up and a plan for our next steps. I've invited her. She's not available to come today. Our state MP, Glenn Butcher, is unavailable but is sending some representatives. He's been working really hard in Parliament when he can to go and speak with them. My understanding, though, is that it's falling on deaf ears.
Good to shed some light on the issue, though. Jemma Manwaring, thanks for joining us on First Edition.